Hi everyone, my name is Morgan, and today I'll be sharing how I rethought a concept that I entered grad school feeling really confident about, and that is therapy intensity, how often and how long we treat. I started grad school with a bias towards more is better, but through very different experiences across settings, I've come to challenge that belief and ultimately reframe what effective therapy looks like for me. Hang on, this PowerPoint's about to get intense. I used to believe that longer, more frequent sessions were always better. The more therapy, the more progress. But after working in both an acute rehab setting and an elementary school, my perspective has shifted significantly. This presentation will walk you through that evolution and what I've learned about clinical decision making in the process. Look at undergraduate Morgan, so innocent and so unaware of how the world works. When I entered grad school, I believed that more therapy, more time, and more sessions was always the most effective approach. And this belief was influenced by my undergraduate teachings about treatment intensity, especially this Murray et al. 2014 article we read about pediatric therapy intensity, which explained that good treatment outcomes are yielded from interventions provided 2 to 3 times a week for up to 60 minutes per session. Concepts like use it or lose it and repetition matters bestowed on me by my graduate classwork concepts further suggested to me that the more opportunities we give to clients to practice, the more improvement we should see. Additionally, there are many current treatment programs out there that rely on intensity for patient success, such as the Speak Out program we use here at MSU. With all of this information, it felt logical to try and keep treatment intensity high at all times. So this is something that I approached early on in my clinical career with a very fixed mindset. I anticipated that longer and more frequent sessions would be the best route to results in every setting I worked in. Well, then came my externships, and they challenged everything I knew about intensity. In acute inpatient rehab, I worked with post-stroke patients and TBI survivors. They were scheduled for 3 hours of therapy a day across disciplines, often having 60-minute SLP sessions rather than shorter 30-minute chunks. What I noticed in this setting is that many of the patients in our care couldn't tolerate that amount of consecutive therapy. Their fatigue was constant, and some became disengaged halfway through or couldn't retain what we had learned due to their cognitive impairment. I remember one stroke patient who had just had a PEG placed, and she was clearly exhausted, but we were only 20 minutes into our 60-minute session. I kept pushing, thinking that we'd get more done, but by the end, she was disengaged and frustrated with me. I left that session thinking, was that really therapeutic, or was I just checking the clock? And that moment really stuck with me. Then, in my school externship, it flipped. Students got 30 minutes a week, often in small groups. And at first I thought, well, how can this be enough? But when I saw progress happening, not just from therapy, but through collaborations with teachers, parents, and built-in supports, I had to reconsider what actually drives change. These contrasting environments forced me to reconsider, was more always better, or did the context matter more than I thought? I think what really helped reshape my thinking beyond my personal experiences was this article that I read by Engel et al. 2021 during my hospital placement. And this article explored how to balance EBP with patient-centered care in medical settings. The authors found that high-performing facilities didn't just rely on current research. They also prioritized strong patient and provider relationships, and high-quality healthcare provider teams were involving patients in decisions, advocating for them, and centering care around their needs, regardless of what would be best for them based on the evidence. Well, in contrast, lower performing hospital sites tended to have more transactional interactions with their patients, where care was simply delivered to patients, not with them. For me, this article gave me permission to let go of the idea that therapy always has to look a certain way or has to last a certain length of time to be effective. I realized that EBP isn't about finding the right dosage from the literature and applying it universally. It's more about synthesizing multiple forms of evidence, research, clinical expertise, and what the client needs in that moment to guide real-time decisions. So I started shifting my focus. In the hospital, if a patient was fatigued after 30 minutes, I didn't push them to hit that full hour just for the sake of it. I felt more confident ending sessions early, knowing I could return later and likely have a more productive session. In a school setting, I stopped fixating on whether 30 minutes a week was enough. Instead, I focused on making every minute count, choosing meaningful activities, collaborating with teachers, and supporting generalization outside of the therapy room. My clinical decision making evolved from how can I stretch this 60 minutes to how can I make this session effective for this client right now. So where am I now? Well, I now see therapy intensity as something to be tailored, not standardized. I consider things like stamina, attention, emotional state, and setting specific limitations. A 60-minute session in a rehab might be ideal for one client, but overwhelming for another. And 30 minutes in a school session can be just as powerful if I build in classroom generalization and support. My focus has shifted from minutes to meaning. What's actually effective and sustainable for this client today? Looking back, I can clearly see how much my mindset has changed. I used to measure success by length or frequency of a session. Now I measure it by how well the client responded, whether they were engaged, learning, and benefiting. I'm no longer afraid to modify intensity, and sometimes that means shortening a session. Other times it's finding creative ways to keep the client motivated and alert during a longer one. Either way, the goal isn't to check a time box, it's to deliver therapy that actually helps. One of the biggest things I've learned is that clinical decision making is dynamic, not static. Intensity has to be personalized, not only based on diagnosis, but also on how a client is doing that day. It's less about following fixed rules and more about listening to the client, to the setting, and to yourself. I no longer treat therapy intensity as a default. I treat it as a decision, one that requires thoughtfulness and flexibility. Some clients will thrive in high intensity therapy and others won't. As clinicians, we have to recognize that and be willing to pivot. In schools, intensity is shaped by realities like scheduling and caseload size, but that doesn't mean that our care has to suffer. With creativity and collaboration, we can still help students make meaningful progress. Most importantly, I've learned that EBP isn't just about applying the literature. It's about thinking critically, reflecting often, and making responsive decisions based on all sources of evidence, especially what the client is telling you that they need. This shift in thinking connects to something bigger for me. Care should be equitable and individualized. Not every client has the capacity for high frequency therapy, and that doesn't make their progress less valid. I'm learning to meet people where they are, not where a protocol says they should be. To wrap up, I've really rethought my entire approach to therapy intensity. What I used to see as a fixed standard, I now view as a clinician-driven decision, and one that should be flexible based on the client's needs, their capacity, and the context of the setting that you work in. As I move forward into my CF, I hope to continue listening to my clients instead of just chasing the clock. Therapy intensity should serve the client, not the other way around. Thank you all for listening. I'd love to hear your thoughts and answer any questions you might have.